would be doing it in two parts, where we would keep the first part of the talk towards more Ayurveda understanding of how a woman is placed in terms of anatomy, in terms of physiology, in terms of unique characteristics that a woman holds. And in second part, I would like you to take through a fundamental thing that keeps running in everybody's mind is about what to eat, how much water to drink, with lot of information that is available on internet, with lot of food fads available. What is the right way? What is a middle path that one should take care of, and that too which is sustainable? Quite a lot of things that we do for a few days, then we give it off. So but now through this platform, through this talk, we'll try to share with you some of the key insights and wisdom from Ayurveda that you would be able to do it every day. And that kind of an awareness or mindfulness which will make you to search for me as a physician, make you to search for Ayurveda as somebody to take care of yourselves, and for a good Ayurveda doctor wherever you are henceforth to take care of your health decisions. So with this, I would like to share thoughts on this. So key topic would be women's life cycle and well-being, Ayurveda perspective for all of you. So the talk is not just restricted to females, but all male members of the family and for everybody who is attending here. My name is Dr. Chankna Buch, as Shreya has already introduced, and I am extremely passionate about health, disease, and in a current situation, changing world of COVID and new pandemics which may come, how Ayurveda really helps to take through. But keeping Women's Day as a theme, let's focus on women as the key forebearers of health. Let's begin with something, a fear which is there in everybody's mind, right? For example, the top disease that comes to mind is breast cancer. So what if a breast cancer were to place an advertisement for a female of its dream? Some way the advertisement in a newspaper would look like this, that searching for an overweight elderly woman to take on a shot who is on an emotional ride, someone who loves to stay up all night, drinking alcohol, eating red meat, indulging in junk foods, pizza, burgers, on chocolates, and who is one who is working throughout the night, who has postponed, delayed her milestones of being a mother. A woman who thinks fresh and and goes on being organic, eating fruits, vegetables, whole grains, and yet who is a person who loves to burn the candles at both the ends, who thrives on stress, isn't exercising, has been a smoker since she was a teenager, and who puts everyone else's needs before her own. You would think that, yes, these type of women, maybe one of us is like this. Is it that at that point of time, we would all get into breast cancer? We have seen in our family, our own sisters, mothers, our aunt, who have been not meeting this criteria at some point or the time, have been succumbed to this monster. So what do you think? Are these things something that lead to cancer? So let me also with this slide tell you that I am not here to scare all of you. I am not here to really put an exaggerate disease. I am here with this slide, with this key point to tell you that health is above all. Health is above all. Our diet, lifestyle, of course, diet, lifestyle perspective is important. But in this current world where we are dependent mostly on wearables. We track our steps, we track our sleep, we track our water intake. We are mostly on app-based monitoring of our health, and we are into diet that is prescribed by someone else, or we follow our trainer. With all these things, we are utmost conscious of our health, yet we are seeing that metabolic disease burden, cancer burden, PCOD burden is increasing. Why? So Ayurveda has an answer. Let's discover that. Similarly, with all working women here, and who are extremely into career, and who feel that milestones of life like marriage, childbearing, etc. can be postponed. It was only that grandmas and mothers that who did it on right time. There is all the time in this world to postpone because of advanced techniques that are available. Here is a common example of fertility preservation. We all know that now eggs are frozen, right? And we could always do this. We could do that when we are in our 25, 30 and postpone our pregnancy, because that is a major thing. And I cannot deny that going through motherhood, that how it creates a break, how it leads to a complete shift in many of the women's life on their career timeline. But this is one of the recent publication, which was in New York Times, where is a story of a lady who says that although she went for fertility preservation, she thought that she could have children on her own timeline. She was wrong. Why? We would discover this through our talk further. So always there are many of the advanced techniques, everything that is available at our service. But will that work for us? And why will it not work for us? Why will it work for somebody and not for everyone? So instead of rushing through all this, let us go back to our basics. And Ayurveda is rightly placed to remind us our basics. Sharing here the human life cycle. So it is important to know that Ayurveda says that lifespan of 100 to 120 years is very much possible if we deal it well. In earlier days, we did see that people lived longer. Up to 120 years was something that could be thought of. In this entire lifespan, first 25 years are predominantly Kapha dominant, 25 to 60 is Pitta dominant, and later as we age and get into that decade of life after 60 is somewhere where Vayu, Vata dominates. Why is it important to know this? Is with each of you at this point of time, you could make a note, make a journal while I am taking you through this Ayurveda concepts, and try to place and build your own timeline of health and disease, beginning with which age and stage of life are you in. Now, when we talk of why do we just placing the fundamentals. So the first fundamental was on stage of life, and then importance of X chromosome. So the sex chromosomes X and Y, as we know that women are XX, men is XY. So why it is important that we understand what as a women, that X chromosome is not only for ourselves, but we are the ones who pass many of the traits, who pass our microbiome to the next generation. So it is important that we take care of ourselves right from a girl child is born, not just for herself, but for the next generations to come. And this knowledge has to be passed on. So you can see here, there are 6 factors: maternal factor, paternal factor, Atmaj, that is soul, wholesomeness, nutrition factor, and state of mind. So these are the 6 factors, the influence of which is highest when a sperm and an ovum meet to form a zygote. As you can see, Ayurveda millennia ago has written down, documented that these 6 factors form the composition of a zygote. So there are listed maternal factors, listed paternal factors. So all are visceral organs like skin, blood, muscle, fat, bone marrow, our heart, our all pancreas, kidneys, digestion, intestines, all of these soft organs, visceral organs, are derived from a mother. All external factors like hair, skin, bones, etc., are paternal dominated. So when we say that my father was diabetic, hence I am diabetic, no, that is not completely right. We get our microbiome from our mothers. So even a son who is born to you carries all these things. Therefore, it is important to know that inheritance plays a role, and mostly it is maternal dominance because all soft organs are derived from mother. Primal prevention, as we have spoken about it, that it is important that maternal exposome, continuous low grade inflammation that is with a mother, not only is a risk for her health, but the generation to come. This includes diet, lifestyle, psychological stress, various pollutants, exposure to smoking, etc. So this is, of course, that during intrauterine life, but what you have been carrying even before you conceive has an influence on the child. And now relating this stages of life that we spoke earlier, kapha, pitta, and vata, to women specific. So the first 10 to 12 years, kapha, then pitta, then vayu. During this course of kapha, pitta, and vayu stage, we go through menarche, we go through conception, we go through pregnancy, postpartum, and menopause. At each of these levels, there are different hormones that play a role. We all know that weight gain, bloating, delayed periods are under the influence of hormones. It is important to know that estrogen levels have a key role on how we progress through. So this is a key slide that I would like all of you to focus on and understand that what happens as a girl child till menarche is a founding stone, is something that is important. We see that lot of girls in our family, our own daughters, patients, coming with precocious puberty. They have got early periods than what at the age that what we have got. Why? It is diet, it is lifestyle, it is changing environment, habits that is influencing this generation. This they would carry forward in conception, delayed conception. The assisted techniques of IVF, IUI, etc. is increasing, and hence it will continue till menopause and later. So it is important that we take care of our own daughters, young girls who are yet to get menarche. And Ayurveda has dictated or stated guidelines how one should take care during menarche, what should be done at conception, pregnancy, postpartum, and menopause. We see that in many of our homes in culture, grandmas have certain rules. You should do this, you should do that during that, but that has been long forgotten. It is time to revisit. It is time to take up Ayurveda. The moment you have a daughter who is going to turn 8 or 9, you should take a call, make an appointment, visit an Ayurveda doctor, discuss, and let her get assessed before menarche. Is she prepared for menarche? The sexual education, all that is fine. All that is being taken care by school as well. But how many of us plan menarche counseling for our daughter beyond just teaching the physical things? Do we teach our daughter what should she eat, how should she take care of her water, motion? We don't. It is time to pause and time to prepare, to bring that cultural shift at our home, to make our family, to make our children health literate. You may think that this is too much to do. It is not possible. And can we just make like, will it be like just making a hospital at home? No, I don't think so. This is to something to do with a health decision. And all of us have seen during COVID that how everybody took charge of themselves. Everybody knew what is HRCT. Everybody knew how to measure oxygen saturation, things that were only being spoken about in ICU or higher centers were started to discuss at home. If that is possible, why not something like a health discussion that happens with our girls, with daughters, with elderly women at home? I feel that it is important that all these key stages of a woman's life, starting from menarche, conception, pregnancy, all of these are discussed. Conception is yet conception, pregnancy is yet taken care by your gynecologist. You do carry out antenatal visits, all of that is being monitored. But yet there is a scope to do more, where you can get into classical Ayurveda diet and lifestyle. You can look into your health risk factors. Many of the women who conceive are with gestational diabetes, hypertension, thyroid. Many of them say, I developed thyroid just when I was pregnant. I got into sugar just when I conceived. I was all right in my first pregnancy. During my second pregnancy, I got into this. I don't know why. So, Ayurveda has an answer to this. It is that the doctor will help you to understand that how, as you age, your body is changing. Similarly, the concept relates when I spoke about freezing your eggs. Well, you may freeze your eggs. That is how it should be if it demands. But when you freeze your egg at 30, will you be the same when you try to conceive or when you plan at 40? No, your body would have changed. Your body is continuously changing. Therefore, it is important that apart from a doctor, you create awareness for yourself. Similarly, when we go to the next stage of postpartum, in many cultures, postpartum is still taken care. There are some kind of food recipes, there are some kind of Ayurveda herbs which are in practice. Some random massages are being done, etc. Yet, some more level of awareness is there in this area when it comes to postpartum, that women are taking care of themselves and the child. But yet, postpartum bleeding, low backache, many postpartum depression, mental health, about creating a balanced work life, so many points at that point. Also, Ayurveda has a scope to teach you, has a scope to take care. And then coming to a graceful menopause, we start thinking about menopause when we are just about at 45, 47, or 50. When we start getting hot flushes, heavy bleeding, it is at that point of time we rush. Do we prepare ourselves for menopause when we are 35? I think so. We should do that. We should start planning and understand, did my mother get an early menopause? What are the signs and risk factors that I may get an early menopause? Or will it be a late menopause? How intense would be my menopause? Ayurveda has a scope to predict that. Ayurveda has a scope to predict who will get into fibroids, who will get into menorrhagia, who will develop some other kind of endometrial thickness, etc. It is important, as you can see, that the peak levels of estrogen from birth to menopause, it is highest at puberty and in perimenopause. Higher the levels of estrogen exposure, that is early menarche and late menopause, is a known risk factor for breast cancer. Why? Because like in cholesterol, we know that there is good cholesterol, there is bad cholesterol. Similarly, there is good estrogen and bad estrogen. So the number of days that we are exposed to estrogen, it starts depositing in our body. Liver is the key organ which metabolizes estrogen, and it is through colon that extra estrogen is fleshed out. So how will you take care with cleansing, with diet and lifestyle to maintain your uh, estrogen? And if you know of that you had an early menarche, your menopause has delayed or had multiple abortions, your hormone fluctuations are going to be higher. If you know this, you would be able to prevent a lot of things and not just restrict yourself to standard screening like mammography. A lot of women do that as soon as they turn 40. Mammography, pap smear, all that keeps on adding. But without, along with that, okay, that is fine to understand the anatomical changes, but body is going through a lot of functional changes. How would you take care of that is a key thing here, which is important for all the women from menarche to menopause to remember. This is one another related risk factor, irrespective of men and women. As we all know, that from the first decade of life, first 10 years of life, deposition of lipids continue. So deeper at root level, this disease process starts 30 to 35 years before diagnosis. We have seen a lot of women talking about cholesterol, talking about sugars, pre-diabetes, all starting by 30, 35 years. But it is not at that moment. The process has started much earlier. Similarly is the process of diabetes, which starts, onset is much earlier than it comes through a full-fledged disease. So now we already spoke about this thing. Once again, I would like to take you through this, that the whole window of prevention for breast cancer starts much early, right from conception, from that puberty to the reproductive stage which is there. So it is important that these stages of life are known in advance. And while we take care, we ensure that menstrual cycle has to be regular. But these are some of the key facts that Ayurveda had pinpointed long back, but now it is known that irregular menstrual cycle is a key risk factor for various metabolic conditions, including cardiovascular disease, type 2 diabetes, and fatty liver. Even the overall uh, health plan or premature death over 24 years among women reporting very irregular or no periods was highest. So menstrual cycle and taking charge of it is very important, not just for fertility and reproduction, but for your overall health too. Now, having said that, we all know, we are all determined here that let's take care of ourselves. Let's start taking charge of our weight, taking charge of menstrual period, food, everything, whatever is available. But would also like to share with you that what is health? Am I healthy? We would come to that. So this is a study which was done on extensive number of patients, and where it was found that sleeping 7 to 8 hours, no smoking, regularly having a breakfast, no more drinks more than 1 to 2 per day, regular exercise, no eating in between meals, being no more than 10% overweight, led to fewer illnesses, felt better, less disabled, and almost 9.5 years later, mortality rates were also lower. The risky behavior which is there, it helps to maximize longevity and expand your number of years from disease. Key is to enhance overall quality of life. So another study again which says that it is important that good relationships keep us happier and healthier was a key thing, where a stable marriage, mature adaptive style, no smoking, limited use of alcohol, sorry, limited use of alcohol, regular exercise, and maintenance of normal weight. All these things were six major factors which were predictors of good health. And more than getting into numbers of lipid profile or cardiac conditions, etc., it was finally the overall harmony that kept patients happier and healthier. So most of us who are here we suffer silently in that twilight zone. Neither are we so ill to visit a doctor, but yet it is too painful to feel good. So at this point of time, in this category would be people getting, women especially getting regular or no okay like frequent headaches, migraine, acidity, some kind of joint pain, constipation, lack of sleep, urination which is difficult, multiple urinary tract infections. It would be that your report would show that there are no microorganisms, but yet you have burning, you have itching, lot of things, like your overall quality of life because of these parameters is affected, or you are not able to eat, not able, or too hungry, craving for items, etc. In such a situation, how can you take care of yourself? So these are the questions to ask, that am I healthy? What is health at various stages of life? What are my known health risk factors? How can I have a better sleep, good appetite, digestion, motion, both solid excretions, both solid and liquid, good vitality, and a calmer mind? Can I reverse a disease that I already have? What is it that can be done to build positive health and immunity? At this point, for all above questions and concerns, Ayurveda is the answer. There is a lot of Ayurveda around us. There are a lot of myths around us. Which Ayurveda do I follow? Answer is follow precision Ayurveda. There are very few institutes who are into precision Ayurveda. Ayurveda is a pioneer to lead and mainstream that role of precision Ayurveda. We are there for you and your family. You will discover that you can reach out at any point of time for building good health. So coming to the point, what is good health? Homeostasis, right balance is good health, which leads to immunity. You can see here and imagine yourself as a person who is standing on a seesaw trying to balance. What are we trying to balance? The dimensions around us, as WHO says, is our physical health, mental health, spiritual health, dynamic environment around us. There needs to be a balance of both internal and external factors. Simplifying this, taking an example that you are in Bangalore, working in Bangalore originally from Bihar. You are used to litti chokha, you are used to that kind of food in Bihar. But now that you have shifted to Bangalore, you have completely different lifestyle of getting into idli, dosa, and completely South Indian food. So at that point of time, how will you try to balance? Or from Bangalore, you try to fly to Delhi for a work, and you see that you are fully all right when you are in Bangalore. The moment you land in Delhi, you end up having fever, running nose. Why? Because body was at a completely dynamic, body was at a completely stable environment when you are in Bangalore. The moment you landed elsewhere, body is trying to cope up with this environment. This coping up of environment, coping up with the environment, and trying to maintain a balance irrespective of time, place, season, is known as health. And what is good health? We will come to that also. Good health is good appetite, good metabolism, good sleep, good clear excretion, both solid and liquid. It also includes excretion in terms of menstrual cycle, clear senses. All five senses are clear, mind is alert, cheerful, optimistic spirit, good and well balanced stress, enhanced immunity, and very good vitality. So, these are the key factors in your day to day work, day to day life. When you get up from your bed, this could be your quick scan. In my view, this is the best Ayurveda non-invasive scan that you could do for yourself. If any one of this is not in right place, you definitely need to pause and understand what is the cause of it. Here, for example, in sleep, you should consider not only duration of sleep. Like people say that I sleep for 8 hours. I sleep at 12 o'clock. I wake up at 7 o'clock, 8 o'clock. How many times in between do you get up? Do you have snoring? Next morning, when you wake up, are you fresh? Are you or are you groggy? Do you have a headache when you wake up? So these are all various key points under each of this that you should know that contributes to good health. So there are a lot of still ways that we could make ourselves healthy irrespective of other parameters just on lab, etc. Now, to add to this, specific to women, I would say that healthy menarche, neither too early nor late, regular menstrual cycles from 28 to 30 days with 3 to 5 days of adequate flow, good sexual health, natural conception at right age, between 25 to 30 as an average, healthy breastfeeding, healthy weaning off, timely and graceful menopause. This for a woman comprises a complete good health. And how does Ayurveda help to understand that? So Ayurveda is a systems thinking which is applied to health. It takes into account your medical history, disease evolution, looks into geography, seasons of life, your inherent health potentials, personal behaviors of diet, lifestyle, habits, etc. And it first defines a complete understanding of the whole person, Mrs. X or Miss X as a whole. It doesn't fragment the person into different departments. It understands you as a whole. Therefore, the solutions provided are also at a whole person level. How do we do that? We do that with 4 things: diet, lifestyle, Ayurveda medications, both external and internal, and through therapies, Panchkarma therapies as it is known as. And Ayurveda Chikitsa is extremely personalized at a whole person level. This is a generic treatment approach that we use for a cross planning of health and disease. And it is personalized to person, place, time, which looks into avoiding of contributory factors, advices for diet, lifestyle, natural Ayurveda medications for alleviating symptoms, Panchkarma therapies at 3 stages: primary treatment, main treatment, and promotive treatment, followed by an advice on good health maintenance plan. These are examples of some of the therapies, Panchkarma treatments that we do. This is just to give you an overview. And then again, we have already spoken about various aspects, but let us also understand potential of Stri Arogya, menstrual care, gynecological care, obstetrics, hormonal care, weight loss, weight gain, that entire aspect of weight management, hair, skin, infertility, from puberty to menopause and behind. Under this whole umbrella of Stri Arogya, Ayurveda is rightly placed to take care of a woman, addressing and giving solutions for multiple specific conditions like PCOD, endometriosis, infertility, etc. Similarly, along with Stri is the connected point of Balarogya. Again, Ayurveda has a capacity to take care of all developmental disorders, immunity, intelligence, all of these things. Similarly, Purusharogya, all connected point on reproductive health, subfertility, infertility, prostate, all of these health issues. When it comes to both Stri and Purush Arogya, common conditions are all metabolic conditions, diabetes, cardiac conditions, digestive issues, skin, hair, respiratory issues, headache, anorectal condition, stress, maintaining good strength and vitality, eye care. Many of the multi-speciality things that are common is Ayurveda able to address. When it comes to senior citizens, especially women and of all categories like sleep, pain, motion, constipation, appetite, balance, frequent fall, energy levels, vitality, and immunity. These are some of the key areas for senior citizen women in specific that Ayurveda can handle. Then comes the whole aspect of rehab, cancer rehabilitation, cardiac, stroke, sports injuries, trauma cases, and de-addiction. Many of us do not know, but we have been pioneers in some of these areas where working with the mainstream system of cancer, cardiac, and stroke, where we are able to handhold the patients for these specific needs. Now, I would also like to pause here and take you through Ayurveda's potential and immunity enhancement, especially for COVID-19, because COVID has been something, a new burden, but has been uh, really devastating, especially the Delta wave. We are also hearing from the Kanpur model that there is a prediction for fourth wave. And we did find that there were patients who were completely asymptomatic, who had just come and go kind of a touch of COVID. There were many of us who had to be really on intense medications. Many of our family members and known around us were hospitalized. We have lost a lot of people. And why? So this is a condition that has been hitting our own immunity, innate immunity and adaptive immunity, the two types of immunity that has been there. Male as such have known to be the highest carriers and risk factor for COVID-19 getting into severity. But women also had kind of COVID severity that was very high. So at this point of time, Ayurveda understands that key markers, inflammation, comorbidities, presence of respiratory infections, metabolism, menstrual irregularity did have a connection with COVID-19. So at this point of time, a completely whole person and personalized COVID-19 risk assessment is available with Ayurveda, where after filling a simple online tool, you could actually understand from all of these key factors that you possess would make you susceptible to what category of COVID-19. This is a path-breaking and a unique tool that has been designed, and this is possible because of Ayurveda's key understanding of human physiology, human pathology, and specific specific involvement of lungs and other organs in COVID-19. So I did want to touch this point on COVID-19 and immunity that Ayurveda is capable of. So we could take a little break here and then we can move on to the next session. Till now, if there are any questions, Shreya, we could take it up. And also your feedback, has it been too fast? Should we bring in more questions in between? Let's pause here for a while and take up a few questions if there are any.
Sure. Thank you, Sankana.
Yeah.
Do we have any questions? You all can unmute yourself and come on audio and ask any kind of questions you all have.
Or should we move on?
I think we can continue, Doctor.
Sure. Yeah. So with that point of immunity, as we have touched upon, we all know that immunity, 70% of immunity is in our gut. And this is because of our microbiome. And gut dysfunction is the initiation of multiple lifestyle disorders. So it is important that we know, we understand our own alimentary canal. We all have been taught about respecting food. We have been taught to include and have balanced food, balanced diet, take care of proteins, carbohydrates, fats, everything. Now, however, there is a fundamental difference between anna and ahar. Ayurveda says that anna is something which is ingested or physically taken through our mouth, whereas ahar includes everything that goes through various routes. It includes even information that is fed through our sense organs, that is through ears, nose, smell, mind. Everything that we take inside has an impact just and has a manifold impact than just the anna. So our ahar, in terms of what we eat, what we listen, what we hear, is more important than anna. You can see here a diagram which talks about Sanskrit terms where rasa, rakta, mamsa, meda, asti, maja, and shukra. What is this? You would be wondering. So the first morsel of food that we eat, from there on, the process of digestion and metabolism begins. With that, the first of digestion that happens, the first fluid that is formed is rasa dhatu. From that is rakta, going on to building of muscle, then fat, bones, tissues, like that. The entire human body is formed from that kind of food that we eat. And Ayurveda says that the first tissue, rasa dhatu, is something which also provides nutrition to manas, to mind. Kind of food that we eat has an impact on our mind, on our thoughts, on how do we carry ourselves, conduct, react in certain situations. So this is an important thing to know from an Ayurveda perspective, the difference between anna and ahar, and why this is important. I'm trying to remind you all once again that this is a key to immunity, gut microbes and immunity. Going back 2 slides, we spoke about COVID, we spoke about good health, where immunity is important. And ahar or anna is important not only in disease but also in health to take care of ojas, our complexion, our strength, the whole agni, that is digestion, that in absence of a normal digestion, normal body tissues such as rasa, the first dhatu, cannot be formed. And in disease, it is important that wholesome food is taken care because it creates inside an environment that is favorable for a disease, for a person to recover faster. Now, here there are four types of Agni here. You could take a pen and pencil and try to grade yourself. So, four types of Agni are Samagni, Vishamagni, Tikshna Agni, and Mandagni. In a well balanced clinical state, Samagni is balanced. Irregular Agni, fluctuating Agni is Vishamagni. A sharp Agni, extremely full-fledged appetite or fire as it is called, is sharp, and very low, impaired or dull Agni is Mandagni. Associated with that are the doshas. If there is a fine balance of three doshas, it is a balanced metabolism. With Vayu being high, there is fluctuation. It is known as irregular metabolism. Somebody with Pitta dominant has a sharp metabolism, hypermetabolism. And with Kapha dominance, it is hypometabolism. So what is the impact of this? So let us understand that a person with Samagni has timings of appetite, perceiving appetite at regular timings. Quantity of food is almost consistent. When it comes to Vishamagni, person sometimes feels extremely hungry, sometimes is very full and feels gas, bloating, pain, constipation, etc. Person with Tikshna Agni has a sharp hunger, is very foodie, can eat well, can digest large quantity of food without any trouble. They tend to have a bit of acidity and reflux, but that in a normal state, if pitta is very fine and balanced, they would be able to digest large quantity of food. People with kapha, mandagni, especially women, tend to have this. They have impaired metabolism. With little food, they feel full and are not able to digest well. These are the signs of mandagni, where hunger is very little, unable to eat full quantity of meals, unable to digest well. There is delayed gastric emptying, like hunger times are delayed. And this determines your metabolism. So by now, you should be able to determine your Agni. Similarly, it is important that you know your Koshtha. Koshtha is alimentary canal. The way you clear your bowels, the way you try formation of motion, habits of passing motion. If motion is extremely hard, it is because of Vata dosha. If it is soft and consistent, it is Pitta dosha. If it is moderate, where you don't have any trouble, but yet could be sometimes constipated, is Kapha dosha. So Agni and Koshtha are very important to analyze your digestion, to analyze your capacity, to analyze your metabolism. So with this, you should be able to pinpoint your level of Agni at this particular time, along with the determination of Koshtha. It is important for all of us to know that Agni has a key role for longevity, complexion, strength, good health, motivation, work that you are doing as a woman in your role, your normal growth, luster, ojas, body temperature. While all of us in high profile roles may be going through all kinds of trainings, all kinds of learning, inspirational reading, all of that. But irrespective of that, it is important to know that this motivation, these things, mostly it comes from within. We see lot of women who have not undergone any of these things, but that josh, but that drive and passion to do things is unique. So that uniqueness comes from within. Ayu, Varna, Bala, Swasthya, Utsaha, Upchay, Prabha, Ojas, Tejas, Agni, Prana. These are all the attributes of Agni. And even the existence of an individual is because of our Agni. Now, this again is an important slide with respect to timing of water. All of us with the current information have been practicing to wake up and have a glass or 2 glasses of water or total 3 to 4 liters of water, etc. What does Ayurveda say? Ayurveda says that one should determine the quantity of water, frequency of water based on one's Agni. We have already learned the type of Agnis. So, if a person takes water before food, it leads to emaciation or lean and thin body. It takes over the part of stomach, so there is less scope to eat food and it is depleting in nature. In between meals, it helps to stimulate digestive fire, that is little by little, not at one go, and it helps to have a good Agni. And when you take too much of water at the end of food or after food, it leads to body fat enhancement and it slows down your metabolism. Therefore, it is important that do not go by, keep these as a fundamental principles when it comes to deciding your water intake. But it is important to know what is the level of your Agni, Mandagni, Vishamagni, all those things are important to decide your water intake. People with Mandagni, for example, a woman with hypothyroid, with PCOD, with obesity, with gas, bloating, imagine that your trainer has told to take 3 to 4 liters of water. Will it suit you? Will you be able to carry that forward without impacting your health? Ayurveda says people with Mandagni should first treat the water, lukewarm water or water with herbs, with digestives, which are able to rekindle your fire or Agni, and then you should take it. So these are some very fundamentals and basics that you should keep in mind before you rush and decide upon doing something very simple thing like drinking water. And in terms of eating food, in terms of quantity of food, I wish this should be like we all are now in a world where we teach our children to take charge of themselves, posters, various key kitchen rules, dining rules, etc. I believe fundamentally, and I have been doing this with my 10-year-old, and I think that all mothers will find this important to do is to teach their children and family about quantity of food. Mostly this we have seen that we tend to overeat or we tend to undereat selectively. Why? Because one is that psychological craving, psychological mind that is involved when it comes to eating good food or food that we like. But it is important that we create this awareness on our dining tables and within our family to tell people at home to imagine and divide their stomach into 3 parts. Always. Now, this has become a conversation. My 10-year-old, whenever there is a pizza at home or anything else at home, she tries to relate this and tells in a language that 2 parts of my stomach are full. I should stop here. That is a cultural change and a shift that is required to teach and imagine stomach into 3 parts: empty, solid, and liquid food, where only 1 part is for solid food, one part for all fluids and one is kept empty. While you may say that this is so clear and very no, basic, what is so big thing about it? But it is, because when it comes to day-to-day routine, when it comes to calls of eating, calls of indulging into junk food, etc., it is important that children know this basic rule very well, and they become the stakeholders of reminding elders in the family. So this is something which I feel that is important for all of us to know. And it is also important to know that to categorize the items that are light and easy to digest, items that are heavy to digest, laghu and guru. So examples, for example, green moong, yellow moong, khichdi are all light items, laghu items. But things like curd, yes, curd, for example, wheat, refined flours, udad dal are all guru in nature. So identifying and knowing well that which item is laghu, which is guru, is important. And we should have some more basic kitchen rules where Ayurveda says that anashana, taking no food or fasting, skipping food is not healthy. We should consider that pramit ashana, habitual intake of food in extremely small quantity, like nibbling in between. Again, there are various controversies. People say to take small frequent meals, but this may not suit everyone. Excessive food intake without any need or voracious eating, again, not a good idea. Consuming food because it is time to eat food, but not hungry, when previous meal is not digested, is a point that all of us need to introspect. Do we eat because it is time to eat, or do we eat when we are hungry? Small but very important point. Viruddh Asana. Again, the current thing of smoothies, mixing items is incompatible foods, right? Like raw foods and vegetables, fruits and vegetables, etc. Milkshakes, milk smoothies are all incompatible food items. And in one day or 2 days, it may not do anything. But accumulation of these things in body leads to toxicity, and toxicity of a kind which impairs your autoimmune system. We are seeing lot of cases of young adults with multiple sclerosis, with ALS. Those early onset Parkinson's is something that you would be surprised to see, that I have been getting younger patients. When I began my career, Parkinson's would be only like 60, 70 years old. But of late, in last 10 years, we are seeing 26-year-old, 30-year-old coming with Parkinson's. So this is all not because of only food. Of course, there is overuse of brain, screen time, etc. But food is important, which is contributing to various autoimmune conditions. Vishamasan is again eating at improper time. Because of our timings of work, we tend to postpone. Can we take a break and find out to set a culture in our office, at our place, where we are able to dedicate some time for ourselves for these healthy habits? Adhyashan is taking large quantity of food is something again which is not advocated. Samashana is consuming suitable and unsuitable again together, that constitute. So that these are the types of food habits that are unhealthy, and each has a role to play. Dietary guidelines. We have seen again a confusing point: when to eat fruits, when to eat dry fruits, what should be done, like when to eat dessert, etc. So in that perspective, Ayurveda says that begin your food with sweet, followed by sour, followed by salty, pungent, and bitter. Reason being that sweet madhur rasa is difficult to digest. Mostly it is that it is carbohydrates. So when you begin that way, you are allowing your digestive system to be tax free. It doesn't burden your system with lot of carbohydrates at the end. So this is something to introspect at timings of food, fruits, chocolates, dry fruits that you have been used to eating all the while. And timing of fruit, as Ayurveda says, should always be mid meals or in a way that it does not hamper your next meal. Fruits are indeed not light, fruits are heavy, specifically banana, chiku, etc. So you should know when to eat and how to eat. Eating with awareness is a key thing. One should eat with self awareness, knowing one's own constitution, suitability, and tastes. Again, types of food we already spoke in terms of laghu guru, but it is also that when foods get inside, it leads to highly hot, cold and dry, or wet. Based on that, it leads to either strength loss, digestion delay, it declines taste and palatability. And a good, well balanced food helps in promoting vigor. So, state of food, the way it is cooked, the way it is stored, way has its impact on body. And these are some of the 8 food factors that one should keep in mind: properties of food, processing of food, quality of food, location, geographical region, season, combination, rules of taking food, and the knower, the user himself or herself, with self awareness, adaptability, health, and disease status. So, with this, I would pause here. So, we have key takeaways in terms of self awareness, in terms of a woman's life cycle, of knowing her constitution, her level of Agni, location, age, stage of life, state of mind, health, and disease status, knowing from menarche to menopause, the entire life cycle, what are the risk factors, why you should take care and plan in advance before the stage arises. Ayurveda food rules, as a women, we could create a charter for home communication and active dialogue. My suggestion would be to involve everyone, including children. And we ourselves, we all are in charge of our kitchen for ourselves and family. But this Women's Day, while everybody is talking about breaking the bias, gender equality, all many things, of course those are important, but how can we really be different by doing some things that are in our hand in a different way, by knowing ourselves, knowing people around us, and then taking charge in terms of implementing and utilizing Ayurveda principles of good health, and just bringing that shift in our homes of carrying out non-invasive screening and making people aware, making a log. You could make a log of 5 people at your home and make a list of everybody's appetite, everybody's motion, sleep. If somebody at your home you can see is always groggy, is irritable, could be, apart from work stress, something really physically fundamentally going wrong. And you could go and advise, you could go and first assess, find out what is it that is happening. Ayurveda food rules are extremely dynamic. We should not stick to just one food fad or one advice that a celebrity or something that is in trend. We should consider where are we located, what is the stage of our life, what is the climate, are there any specific requirements that we should do. I always keep telling at the hospital kitchen to the patients that how many of us change the spice box that we have, the masala dani that we have at our home according to seasons? We don't. Ideally, we should. That whole thing of taking charge of everybody's health begins from kitchen. For every season, that masala dani has to be reviewed, has to be really changed. This may sound very simple, but it is important. We need to create our own timeline of health. uh, I would take some example that Miss Pooja, for example, is 40-year-old. Now, at this point of time, going back, how was the menarche? How was conception? Or if single, what are those risk factors in that reproductive health? You could create your own timeline. We are very good at Excel sheets, etc. So let us today take a pledge to go back and plot a timeline. My first 10 years of life, my 10 to 20 years of life, my 30 to 40 years of life, my 40 to 60 years of life. And on this plot, what are the risk factors? Did I have any event? What is it that I can do from an Ayurveda perspective to cut down that impact of risk? I believe this is something very unique that nobody is talking about. And it is important that we do this. We bring this fundamental change in our family, and this through a comprehensive prescription of ahar, vihar, vichar, aushad, and kriya. Let us not confine to eating only this healthy food or going for yoga, going for Zumba. Do you observe? Do you think that what is the state of mind? What is the vichar of your husband, of your father, of your son, your grandfather? You need to think differently. Then, of course, there are Ayurveda, Aushads, and Kriyas that you can always take help. And we would be very happy to help you from Ayurveda, where I would want to share with you that Ayurveda has been an institute with path breaking events that we have been over our journey of last 15 plus years that we have been into. We are into very specific disease biomarkers, international outcome scales, functional health, and patient satisfaction. This is a unique thing of outcomes tracking, which none of the hospitals, I am very proud to say that at every stage of care, in process parameters, clinical outcomes are monitored and leveraged for safety, effectivity, real time, and entire life cycle patient health management that Ayurveda has been doing into. And with this, we have like 8 indoor hospitals with 4 NABH, 1 JCI, and 3 hospital with leading quaternary care hospitals. And recently, we are also into cancer integrative oncology with a super specialty cancer hospital in Bangalore. We have, to our credit, various kinds of cashless insurance which is available, precision Ayurveda care model which is appropriately integrated with modern medicine, and some of the accolades and awards that we have been leadership at national Ayurveda level. Mr. Rajiv Vasudevan is the CEO, who is the member of Niti Aayog Council on Integrative Medicine, on Niti Aayog Expert Group on Wellness and Nutrition. He heads Ministry of Ayush Experts Committee on Ayush in Ayushman Bharat and National Ayush Sector Skill Council. So these are some of the key areas and leadership roles that Ayurveda is into. As you can see here, very proud to say that India's first NABH accredited hospital is in Bangalore, and now 4 of them. With all this, I would like to pause here and ask all of you to put forth your questions, put forth your concerns, hesitations, and queries. Would be very happy to answer all of them.
The floor is now open for questions. Sumana, Seema, would you all have any questions? Doctor, I don't think we have any participants with questions. Is there anything
Okay.
over and above with what you've shared that you would want
Yes.
to let us
So,
know?
what do you feel, Shreya, for the points that something that people could relate to? If you could take your own example, would you would you find some of the key takeaways that we discussed doable? Do you think this is the way that we should be contributing in bringing that change in health perspective?
Definitely. What you have shared with us is very much doable with right guidance and counseling. Of course, everyone would have had a try on Ayurveda in their own way, but a systematic
Yes.
approach, or organic approach, is what is required, and we seldom miss out on that. So, yes, with Ayurveda being there, and with all the offers that you are going to announce, I'm sure our entrepreneurs will take benefit and better their health, both their self as well as the family. But doctor, I would also request you to cover something on psychosomatic issues. As entrepreneurs, as women entrepreneurs, uh, in that phase of playing different roles that you've explained,
Correct.
shifting between responsibilities, at the same time doing a lot multitasking, the stress levels are definitely there. So, how does one
Yes.
handle the stress level, synchronize with the mind and the body? If you could please throw some
Yes.
light on that. Thank you.
Yes. Yes, thank you, Shreya. So it is important, yes, that as we go in that higher roles and leadership roles, there is a kind of a unique balance that is expected to stay calm. At the same time, we are expected to continue with that zeal, continue with that passion, and that in a way creates a turbulence in our body. At that point of time, if we look at the changes that happen in our body from an Ayurveda perspective, it leads to either excessive Vayu, Vata in the system. It leads to excessive Pitta in the system. When there is excessive Pitta in the system, there is anger, there is outburst, there is lot of Rajas in the system. When there is Vayu, Vata in the system, there is restlessness, there is palpitation, there is racing of heart, racing of mind, loss of sleep, constipation. So when a woman in that role, in that time, is going through stress, first should understand what is it happening and try to analyze what are the physical signs that she is going through, what are the mental or psychological signs or symptoms that she is going through. Try to demarcate that both. Once you do that, once you get into that habit of demarcating that, you will know how to handle which one. There are methods in Ayurveda to take care, to demarcate and take care of both physical as well as the psychological symptoms. And every woman who is here, who is in that role, who may be often going through this situation, my advice would be to, of course, those relaxing techniques, spa, yoga, everything is fine, but that may not be possible on day-to-day basis. Instead of that, have a consistent routine of getting up in the morning, and as soon as you wake up, as we spoke, to do a quick scan, right, about your appetite, sleep, and make a note of it. Inculcating that habit will help you to get better charge, both of take charge of your both mind as well as body. Once that is done, you would know that you would be confident that the physical symptoms are taken care. And then, whatever are the psychological symptoms, once you go through your work grind on day to day basis, ensure your water intake, food timings, etc., are taken care. It is easy to say than done. But yet again, taking those small changes and bringing those small changes will help you to take a better control. Once you are done in the evening, you should know that the day has these dosha cycles, like kapha is high in morning, pitta is high in afternoon, and vayu peaks in the evening. So by the time you reach home, by the time you are done with your day, some routine of taking ayurveda good oil bath yourself, this again is a method of like a habit forming thing to take care. It, you will see that it calms your system, and a hot shower after that. So these are some of the basic things, and then trying to introspect, trying to work. How could you have gone wrong? You shouted at a colleague, you came home and you shouted at your family member. The whole vicious cycle that you are aware of. But why are you shouting? It is that pitta which is making you shout. So, your choices of food, you could cool yourself to reduce your pitta. You are restless, you are anxious, not able to sleep. Is one is stress, but where does that stress stem from? It stems from those doshas, those imbalances that are in your body. And you need to, at that point of time, choose right food. For example, you could see that women tendency naturally is to choose towards sour, tangy items, pickles, spicy items, right? It is the first cause of excess pitta in the system. Whenever you are going through that phase, try to reduce those kind of items which puts into excessive pitta or excessive vayu in the system. Balance that, you will see a good change. We see a lot of, I'll give you an example of a 40-year-old Shubhra Sharma, name changed for example, last week was with me for a consultation. 47-year-old, mood swings, painful periods, lot of joint pains, and she is one of the leaders in one of the well-known IT company. She says she goes for regular spa sessions, she goes for regular yoga meditation, takes a break, etc. But yet, when she came and was sitting in front of me in the consultation, I could see under eye dark patches. I could see that she was groggy. She was not, although she was doing all these things, I could not see good health, hypothyroid, pre-diabetes, hypertension. Well, that is fine. Then I just told her that while you are doing all this, are you watching what are you eating? Are you watching how is it being cooked? Are you watching the type of water that you are drinking? Most of the items of these things could be really contributing to your stress. For example, all tamas foods, bread, burgers, non-veg, for example, inherently is heavy, inherently leads to tamas in the system. So my advice to women entrepreneurs who are in high profile role and who are going through that stress, learn first to demarcate. Demarcate your physical symptoms, 1, 2, 3. Demarcate your psychological symptoms, 4, 5, 6. With that, you take charge. Visit your food, visit your water, visit your physical activity. And with that, try to find a solution. Seek an Ayurveda advice, reach out to a good Ayurveda physician, and for yourself, after knowing, as we spoke, knowing your Agni, knowing your Koshtha, etc., have some rules. If I go through this, I need to do step 1, apply oil on my head. Step 2, apply oil on my feet, nasal drop, or hot shower. So make your diary that in this situation, what should I do? When you know that, when you do that, it will have, you will have a lot more grip. I hope that helps, Shreya.
Yes, yes, doctor. That was very informative. Thank you so much. While you were talking, we have a couple of questions from our participants.
Yes.
The first question was from Sumana, where she specifically asked about, what spices should be used around what season. So you mentioned
Yes.
about changing the spice box. So is there any, I know each family member's health is individualistic by itself, but otherwise, is there a generic advice on this?
Yes. So Ayurveda has a lot spoken about various spices, various types of spices. The routine spice box items that we use are mustard seeds, cumin, asafoetida, curry leaves, cardamom, clove, all of these things. Ayurveda has recommended all of this, and it has also pinpointed, for example, black pepper is hot in property, ela is cooling in property, cumin is digestive and cooling in property. So, as per the season, as per the dosha, there are categories of spices that are recommended. Ajwain, for example, is an extremely ajwain or dill seeds is an extremely important vata reducing. The moment somebody gets acute abdominal pain, especially during periods, I am not giving just kind of a remedy or advice, but an example that taking ajwain seeds, for example, grounded with hot water, helps to release that abdominal distension and bloating. We see a lot of people with urticaria or sudden rashes. Ajwain is an antidote, ajwain and jaggery. So, like that, Ayurveda has spoken about various spices and in different forms to be used with different vegetables, dals, etc.
Great. Thank you, doctor. Our viewers would also want to know if Ayurveda does online consultation.
Yes, we do have a platform for teleconsultations and spanning from prevention to primary care to adjuvant care across medical conditions, multi-speciality for everyone, women specific, children specific, various kinds of rehabilitation. We have been doing online consultations across our centers, and we have 4 locations in Bangalore, and in other centers are in Kerala, Delhi, Uttarakhand as well. So all of the centers are open for online consultation. We do have some offers as well for the privileged entrepreneurs here. I'm sure, Shreya, you would be able to share with all of them.
Yes, doctor, I will be sending an email to all registrations. And we have one question which has come offline. So
Mhm.
the question is, how can one transit from, uh, a user who's like been with allopathy medicine lifelong? How can they transit from allopathy to Ayurveda? Is there any
Yes.
specific do's and don'ts, or can it run parallel? How does it work?
Mhm. So that's a very interesting question. And at this point of time that all of us are going through, it is important that there has to be a right balance. That stream of medicine is known as integrative medicine, and Ayurveda is is known to carry out that seamless integration. Where somebody is on many medications in allopathy, we need to understand the objective of those medicines. Those medicines could be anti-diabetic, anti-hypertensive, or blood thinners, or some other kinds of important or life-saving drugs. Then there could be symptom alleviating medicines like antibiotics or painkillers or hormone replacements, etc. So, a good Ayurveda physician will be able to understand the need of that prescription, and based on that, plan Ayurveda medications for you, which will help for a seamless integration. It is important that an Ayurveda doctor that whom you consult should be aware of this. It should not be an abrupt withdrawal of any kind of drugs that are being prescribed. And with this, the transition will be extremely smooth by tracking the need of those medications. For example, antacids or some kind of painkillers, laxatives, digestives, etc., can be within short time be replaced with Ayurveda medications. But higher the drugs like antihypertensives, anti-diabetic drugs, statins, etc., with the watchful tracking of symptoms should be transitioned to.
Thank you, doctor. Can you please share information on Ayurveda Hospital's signature program, Diabetic Reversal Program?
Yes. So Ayurveda Hospitals is a pioneer in carrying out diabetes screening questionnaire. So Ayurveda has developed a unique tool which a physician will take you through to know your diabetes risk and severity risk. Like Indian diabetes risk score has already been established that with so and so risk presence, a person is known to have diabetes. Now, Ayurveda has also spoken about some of the key risk factors that who develops diabetes and to what stage of diabetes will one progress to. So, Ayurveda carries out this screening for every patient that we have, and it helps you to understand your risk score. Based on that risk score, there would be an advice to work with you on diet, lifestyle correction. There could be various modifiable factors like weight, food habits that you need to change. And once that is done, we also help to establish severity. If a person is already diabetic, type 2 or type 1, by the time patient would have progressed to certain levels of severity like numbness or urine frequency, many known complications of diabetes, eye, bone, joint, nerves, so kidney, so quality of life parameters. So it helps you to establish both. So Ayurveda has developed this tool. So I would urge all of you with Shreya's support, etc., if people are able to reach out to take this diabetes screening for themselves, it will help to understand a risk and severity, even if you do not know that you are diabetic. And even if you are a non diabetic, you would be able to understand what more could be done to control that severity. And we have
Wonderful.
been working with diabetic patients for reversing diabetes, right from pre-diabetes to mature diabetes to complications. We have been also working with children and parents of type 1 diabetes. Well, insulin cannot be replaced, but Ayurveda is uniquely placed to complement the ongoing care for type 1 diabetes. Dose dependency on different types of insulin, good diet and lifestyle advice, and what happens with young children. I have seen this of late in last 1 year, especially after COVID, that young children as small as like 8 years, 4 years, coming with a recent onset type 1 diabetes after COVID. There is inflammation, and Ayurveda helps to calm the body. And overwhelmed parents, like people, patient parents and children don't know how to take care of themselves. So in such a situation, even for type 1 diabetes, Ayurveda has been doing a great work in terms of handholding children and parents.
Thank you, Dr. Zankna. One last question. If someone would want to, kind of holistically revive their health and get into the pace of their age and nature, how can they do so? Does Ayurveda Hospital have some kind of a program for a systematic approach to revive
Yes,
one's age? Like, say, for example, uh, if I have to just talk about pregnancy, most of the time when they are pregnant, they get into a good lifestyle. But the
correct.
ideal time to do that is before they
Before.
plan or during the conception phase. So, what is your advice on this? Is there any program that Ayurveda runs to help individuals
Yes.
with this?
Yes, so Ayurveda has been into entire patient life cycle health and well-being. That has been a key thing. And as I mentioned in my earlier slides too, that right time to take care of health would be before the stage arises, before menarche, before conception, before pregnancy, during antenatal, to plan postnatal, and before menopause. So we have a rigorous system, process, and protocol of carrying out consultation, either in person or teleconsultation, where we take in initial screening the entire details of whole person health and well-being, diet, lifestyle, motion. All of these Ayurveda vital parameters are captured. Then we also capture the allopathy vital parameters of weight, BP, sugar, etc., the other important lab criteria. After that, we go through an initial consultation where we understand and hear from the patient concerns, the list of medications, family history, past medical history. We confirm all that with lab investigations. We carry out Ayurveda as well as allopathy clinical examination, followed by the whole process, 5-step process of diet, lifestyle, medications, comorbidities, and a disease tree is drawn. After the disease tree is drawn, understanding from both allopathy and Ayurveda about the given disease, stage of disease, what are the risk factors, how should one take care, either with diet, lifestyle, medicine, or therapy. Does that situation require Ayurveda physician to take a call whether we can treat or not treat? Do we need to integrate with the allopathy counterparts or no? This entire thing is then discussed and agreed upon with the patient and the doctor and signed off. After that is the treatment plan, which looks into, depending upon the identified need, what is the immediate need a patient has, what is a need in long term that a patient has, and what are the health management plan that one should do. So in my view, being very honest, being very unbiased, I would say that reading all medical literatures, there could be many doctors listening to me here right now, many women entrepreneurs who are into health systems or digital health systems, etc. I would urge to visit that entire protocol and platform that Ayurveda has developed over a period of time is about a unique chikitsa, not just Ayurveda chikitsa, but the entire way of managing a patient's life cycle is extremely unique. And I have been somebody as a physician along with my team that I have been doing this day in and day out for the patient. So for every stage and age of a patient, whether it is pregnancy or pre-pregnancy or IT folks, for example, with for women entrepreneurs or with IT background, people are into highly stressed environment. There are unique programs for functional health enhancement that you should look into. And apart from just that, variables and measurements, how you could go through a non-invasive screening to plan your health and disease.
Excellent. Before I announce the offers which is shared by Ayurveda Hospital, Dr. Zangna, if you can please quickly share what are the facilities available at Ayurveda Hospital for both
Mhm.
inpatient as well as outpatients.
Yeah. So, as I told, in Bangalore, we have two standalone Ayurveda hospitals. Both are outpatient as well as inpatient, supported and empaneled by major insurance players, cashless as well as reimbursement based upon your policy terms and conditions. It's a fairly large team of doctors, nurses, we call it as caregivers, who look into outpatient and inpatient Ayurveda Panchkarma treatment across multi-speciality. We have in Bangalore also hospital in hospital. For example, in Aster CMI, in quaternary care is Ayurveda hospital placed, where we work with the mainstream neurosurgeons, obstetricians, physicians, gastroenterologists, nephrologists, for example, for CKD conditions, etc. We have in Bangalore Sri Shankara Cancer Foundation, where we are working right with the medical oncologist, surgical oncologist to provide integrative oncology. We have similar health in health, hospital in hospital unit at Medanta. Within Medanta, Ayurveda is an indoor outdoor facility. We have similar standalone unit in Kerala, as well as one more hospital in hospital unit at Aster Med City. And we have a very beautiful and a pristine NABH Ayurveda resort-like ambience in Uttarakhand, Almora in Himalayas, where classical Ayurveda is carried out. So this way we have our presence across India in both standalone as well as in integrative facility.
Thank you, Dr. Zankana. This was a wonderful session. With your permission, I'm just going to announce the offers shared by your team. So thank you all for being there through the session. Ayurveda Hospital has shared some offers which is available month long for you all. So on consultation, you will get 25% off. On therapies, you get 7.5% off. And on medication bought at Ayurveda hospitals or at their centers, you get 5% off. So this is available for all who have participated or registered with us for this program. Email will be sent to you all with the details, and you will just need to flash this mail at the reception to get the discount. And please do make the best of this. It is a wonderful space to be in. Being holistically healthy is an achievement by itself. And after Dr. Zankana's session, I'm sure all of you will agree with me on this. Thank you so much for being here. Thank you, Dr. Zankana.
Thank you, Shreya. Happy to contribute. Thank you.
Thank you so much. Y'all can join us back for the next session at 1:30 p.m. The same Zoom link can be used. Please do join us. The next session we are going to have Chinuji Srinivasan talking about emotional and social well-being. This is 1:30 to 3:30, and from 3:30 to 5:30 we have Uma Madan talking about spiritual well-being. So hope to see you all again. Please do log in time and make the best of the sessions. Thank you.